In order to be diagnosed with hemophilia, a medical worker will have to test your blood. The symptoms of this disease all deal with bleeding of some sort in or out of the body. Bleeding in the joints is a symptom which creates swelling, pain, and/or tightness in the joints affecting the knees, elbows, and ankles. A lot of symptoms can go undetected until physical action is taken, like bruising, nosebleeds that are hard to stop, and bleeding after getting vaccinated. Infants have their own symptoms, for example if a male baby is getting circumcised afterwards, if bleeding is continued, and bleeding in the head of an infant after a tedious delivery. 1 in every 5,000 male births are diagnosed with hemophilia. It is presumed that there are between 20,000 to 33,000 males in the United States living with hemophilia. It is likely that there are significantly more men with the disease. Hemophilia A is over 4 times more common than type B, and while hemophilia has been shown to occur more often in Caucasians, hemophilia occurs across all race demographics. For research purposes, we have primarily focused on hemophilia type A in this video. You may ask what the options are for treating hemophilia. Replacement therapy is one of the biggest ways of how hemophilia is treated. Replacement therapy is taking concentrates of the clotting factor 8 or 9 that are dripped or can be injected into the vein. These concentrates are made up of human blood, but there are others that are not made from human blood that are available to children. There are downsides of replacement therapy, like developing antibodies that could potentially attack the clotting factor and developing viral infections from the human clotting factors. Like the symptoms where this affects your joints, a complication of this therapy is muscle, joint, and other body parts resulting from delays in the treatments. Hemophilia is likely to become the first widespread severe genetic condition to be cured by gene therapy. There are currently 2 ongoing studies of GenStar based on the peripheral vein injection of a minimal, gutted, adenovirus containing a full-length FIE cDNA and with an albumin promoter so it can drive liver-specific expression. The first trial in hemophilia that the transgene has been specifically targeting a particular tissue and first in any disease of a gutted adenoviral vector. In the first patient of this trial was HCV uninfected and had a normal liver function, but the trial was stopped because he developed a systemic side effects like fever, moderate thrombocytopenia, and impairment of liver function tests.